Well, welcome, everyone. This is Jeanne White again from Social Connections at Passionate World Radio Network. And you realize I am doing a series for these caregivers and being able to let them tell their stories in their own words. And today I have another individual. Her name is Marcia Burr, and she is online and ready to talk. Hi, Marcia.
Hi, Jeannie. It's nice to talk to you today. We've been trying to hook up for a while now, and I'm glad it's finally happening today.
I am, too. I'm very happy. So I wanted people to, if you want to give a little background about, who are you caregiving for and, how did the journey really start for you?
Okay, it's kind of a long story, and actually now I'm on the other side of caregiving.
Okay.
I was a caregiver to my wife.
Uh-huh.
Her name was Gaydana Dandona, and you can't even make that stuff up. She was an Italian. Her father's name was Gaidano, and Gaydana is the, female version of Gaidano, and her maiden name was Pizzo. But then she married a guy back in the 70s or 80s with the last name Dandona, and thus she became Gaydana Dandona. Wow. And she had a daughter, and when they divorced a long time ago, Gaydana kept the name for her daughter. And also she was a DJ on a radio station in the Upper Peninsula of Michigan. Yeah. And it was like during the time when Rosanna Dana was popular, and so she made a goof off on that, doing pizza commercials on the radio station that she worked for, Gaydana Dandona Rosadona or whatever she said, but it was funny. You just can't make that kind of name up.
It sounds really funny. It really does. It's really, it's terrific when you have that, when it's something to laugh about.
It is, absolutely. Yes. Humor is what kept us going through it, and it's kind of a long story for me, and it's maybe a little different from other people's stories because, everyone's different. We all have different layers, The bottom line is we're all caregivers, but even beyond that, we're all just human beings trying to get along on this planet, doing the best we can.
I know. We're trying to all survive. We're trying to all survive together.
Exactly, and that's how we're going to survive this, is together. And by sharing our stories, I'm such a big proponent of people stepping up and sharing their stories. I'm so happy to see so many people now who actually have dementia and are still able to talk and use the computer and do things. They're starting to share their stories. They're making videos.
Right.
And it's really important that the world sees this so people lose their fear. It's a taboo thing. People are afraid, and when they're afraid, they either ignore it, they swim down denial river, or they're very judgmental and they have harsh words and mean and hateful things to say about it, when the biggest lesson that dementia caregiving taught me was how to live in the happy place. What I learned is, after words didn't matter anymore, and Gaydana didn't remember that we'd lived together for 20 years, that we were finally able to get a piece of paper that said we were married, 9 months before she died.
Yeah,
she didn't remember any of that. What she remembered was the energy that she was in. And that, to me, is probably the biggest lesson that I learned in dementia caregiving, is that it's our energy that speaks. It's our heart. And love is the language that speaks loudest. It's the loudest energy that we possess as humans. It speaks louder than fear. It speaks louder than hate. It speaks louder than anything. And so we decided that she had gone for a walk one afternoon. Let's see, I don't even know how old she was exactly when she was diagnosed, but let's see. It was probably around 2009. Yeah, 2009. Mm-hmm. And she had gone for a walk with a friend. They'd take their dogs together and go around to the other countryside of the block that I live on. and there's horse farms out there, and it's just beautiful. You can see the sunset. So they're out there counting horses, and Gaydonna couldn't count anymore. Now, this is probably the smartest person I've ever met in my life. She ran X-ray equipment in special procedures at a VA hospital, which is imaging, lifetime, real-time imaging of blood vessels. It's a sterile field. It's like working in an OR. And so here's a woman that could do all of these things, was a professional photographer. We owned a photography business together in Gainesville, Florida, and she couldn't even count. Wow. And so she got diagnosed. And I'll tell you the truth, I come from a medical background. I worked in a Trauma 1 ER teaching hospital in the middle of the night on weekends. And believe me, I've probably seen about everything there is to see. And there's not a whole lot that flaps me. I stay pretty cool and calm. And I'm a good person to have around in an emergency. But let me add that there's really not a whole lot that environment, working in that environment for 7 years, taught me about dementia, caregiving, especially to my wife.
Right.
To the person, my soulmate that I'd spent 20 years, a third of my life with.
Right.
You know, wow. And, you know, one of the tendencies of medical people, myself included, is we tend to think we know it all. And so I was in denial for a year. I was like, nah. Because I didn't go with her to the appointment when she got diagnosed. Honestly, I was going through my own life lesson at the time. And so what I'm about to tell you is the two stories are very much intertwined. I was an alcoholic. I had a widowmaker heart attack. I survived a widowmaker heart attack in 2009, brought on from drinking, sitting in front of my computer, chain-smoking cigarettes, and drinking right out of a bottle. And so I'm lucky to be alive. And the drinking, when Gaydonna and I first met, which was back in 1997, which is another interesting, funny story, I wasn't drinking. But then life happened. And my mom died of colon cancer. I was her caregiver for a while. I actually dropped out of the X-ray school, which is where I met Gaydonna. And I was making a drive down to Miami, Florida every week. And I live up near Gainesville, Florida, in a little tiny town called Williston. It's a long drive. It's like a 6-hour drive one way.
Oh, wow. That's a long drive.
Yeah. And so my mom fought colon cancer for 7 years, and she finally decided that she was going on hospice. She tried experimental new chemo drugs, everything, and it was too late. So she decided she wanted to be home, surrounded by the things she loved, looking out her back window with her piano right beside her. She was a music college professor. She taught piano and other things.
How
and that's what we did.
Yeah.
And so, you know what her primary doctor told her 3 daughters? Ooh, it made me angry. He said, oh, so you're just going to pull the plug, huh? I was furious.
Well, that was compassionate on his part, right?
Well, yeah. It was like all about the money. So much of this comes down to all about the money. You want to know why caregivers don't have help? Follow the money. You want to know why we haven't found a cure sooner? Follow the money.
Because I always say, you know, Marcia, that any hospital or physician, it's the bottom line. That's that bottom figure that they're looking at and nothing else.
And, you know, I get it. I mean, I ran my own business. I realize there are budgets. I realize there are practicalities and ways to do things more efficiently. I understand all that. But that's not the paradigm I'm speaking about. I'm speaking to a bigger disease in the world called greed and fear. And that's back to the biggest lesson that caregiving taught me was how to have an open, trusting heart, how to listen with my heart, And the last 3 days Gaydonna spent on this planet, after being denied hospice cares, 2 weeks earlier, over Easter, we spent Easter, her favorite vacation, in the hospital. And she was denied hospice care. You know why? Because she spoke an intelligible paragraph.
Oh, okay. Yes, I heard about things like that.
Yeah. And she X'd herself out of being a hospice candidate. And this wasn't going to fly with me. I'm sorry. I've worked in the medical system, and once I finally realized and came out of denial and that this wasn't about me, it was about my wife, someone I love, is losing her mind slowly every day.
That's your soulmate.
I was her voice. Yes. Yeah. I was the one. And, she forgot my name. She'd wake up and say, so where are we? I'd say, we're in Williston. And she'd go, and so do we live together? And I'd say yes. And, she'd get reacclimated to her surroundings upon awakening. At the end, she would either call me mommy or that woman. Where's that woman? Where's that woman?
Yeah.
And, this is what happens. And she was always looking for home. And this goes back, again, to part of the big lesson I've learned about caregiving is, you know what, Jeannie? We're all looking for home. Mm-hmm. It's like a big cosmic joke that the cosmos is yelling down at us, little plebeian humans on this little pale blue dot, saying, hello, people down there, did you forget something really basic, really, really important? Did you forget that there's no room save for love? We lose that when we come on this planet with our ego. It's like we mistake our ego for what it is. We forget we're connected, that we're all on this one little planet together. It's our little spaceship on the journey called life, and it's sacred. And we forget that in our busy days.
Yeah. Everyone forgets it, basically. I myself, sometimes I probably do. I try not to, but I know that I'm not here alone and that I'm here to help out,
Right, and that's where the care, we're really becoming a voice that's starting to get heard. And almost every caregiver that I talk to that's, done this for a little bit and is starting to get it, that we make this stuff up as we go, because there's no manual that tells you how to be a good caregiver. You have to listen, and you have to watch. You have to observe with your heart, openly and honestly. It takes a lot. It's like I'm a completely different person after caregiving than I was when I started. Completely.
What I find with the caregivers too is, I'm sorry?
I was going to say, this is the person who used to go to AA meetings and say things like, God, if that was me, just shoot me. It's horrid. And it was so self-centered of me when I was starting to finally get past denial. It took a friend of mine taking me aside one day saying, Marcia, Marcia, Marcia. It's not about Marcia. And you know what? It pissed me off. It did, but I went home and I thought about it, and I had a complete shift. I had an epiphany, a heart lesson. My heart opened up, and I realized it wasn't about me. And I decided this is the person I love. This is someone important that has value, and I'm going to be her voice. We decided that, you know what, we all live till we die, and we're just going to hang out in the happy place, and that's what I call it. That's where I live now, even to this day. And that doesn't mean that everything is sunshine and roses. Heavens no, what a boring planet if everything was always happy, good all the time. We'd never learn anything. We would just stagnate. But I've also learned that I have, there's some things in life we can't control. There's no cure for dementia yet.
No.
We work on it. We keep working. We never quit. But I do have control over how I decide to respond to the circumstances that I'm in, that I'm faced with every day of my life. And so is every other person on this planet. That's where our power is.
I think people forget that. People don't realize how much power they have as a unit.
Right. And this is we're starting to come together more. It's happening.
Yeah.
You know, it's really funny because I spent, like I said, my journey of recovery from alcohol is so intertwined with my journey of caregiving. I really can't separate the two. Mm-hmm. But I took some steps, and they worked for me. And I became honest with myself. I decided to look at my dark side, to look at those mutant dust bunnies collecting under my subconscious mind. Mm-hmm. And I decided to hug my dark side and say, it's okay, I love you too. Mm-hmm. And when I did that, it was a very freeing thing, and it also opened my eyes to a bit more compassion and a bit more being centered.
You gave yourself permission.
The biggest thing that taught me that was caregiving, because I had a platform to practice it every day of my life. And it's changed me at a core level. And as horrid as dementia caregiving can be, and as dementia is for the people that go through it, our loved ones, right, as horrid as it can be, there's many blessings and lessons in it too. And at the end of the day, we don't lose our loved ones. We're still connected, because you can't destroy energy. And that's how we learn to communicate with our loved ones.
I think for me, like I had two friends, and I think the part wasn't able to communicate. That for me, it was for me to touch her and to my two friends and to hug them, and I'd give them a kiss on the cheek, and they would know it,
Exactly. And music.
Mm-hmm. Oh, they love music. Oh, my God, do they love music.
Music can connect you right back to a time and place. Mm-hmm. It just can do that. It has that magic power. And Gaydana and I talked a lot, while she could, about what she wanted to do and how she wanted things to be. And she wanted the world to know. She wanted me to tell our story.
That's right.
And I promised her I would.
Yeah.
And that's what I do every day, from a place of gratitude. Gratitude is something that has really, literally changed my mind. And that just means that even in the worst of times and situations, I can still find something good about it somehow. I can make it into something useful instead of just wallowing in the negative, sapping energy that just kills my soul.
Well, I think, too, is these support groups, and they're private, is beneficial to anyone, really, that can be able to vent and not be chastised for what they're saying. And I think that's what a lot of the caregivers cared about. And I know we had talked about Betsy.
Yes.
Yeah.
Betsy,
and I met Betsy. I met Betsy Worcel, and it just so happened one night, and I'm not usually on Facebook, I'll just tell you quickly, and I happened to see her video, and I was truly compelled to tell her, and this is how it all started with Betsy. And
wow, I love that.
Yeah.
Yeah, I've known Betsy. I've known her about 3 years, and we met up through another very small, secret, or no, it wasn't secret, I don't think it is, a closed Facebook group. That were sort of outcast from some of the bigger groups where I've seen a lot of judgment and a lot of misunderstanding.
Yeah.
And instead of tolerance and just allowing people the space they need to express themselves so they can understand better what they're going through. Sometimes that's all we need, is someone to sit and listen to us. It doesn't mean we're actually going to go do what we're saying. We're just venting our feelings. And people jump off these cliffs of paranoia and thinking they know best for your loved one when they haven't lived it. And we all know that any good neurologist will say, if you treated one dementia patient, you treated one dementia patient.
Right.
Everyone is different. Everyone
is different. And I know with Betsy, she is really a huge advocate. And I don't know if you know Cassidy Bestine.
Oh, yes, I'm good friends with both of them, as a matter of fact.
She's been on my show, and sometimes we're going to be doing some Zoom, 15, 20 minutes about Just talking in general about things that happen and, people may not be aware of, suggestions, tips, that kind of stuff.
Yeah, the latest. Stuff like that. I like that. Listen, have you interviewed Vince Sangaro?
No, I have not. I don't recall the name. No, I have a
list.
Well,
you can look him up on Facebook. He started a thing 7 years ago. His father died of dementia
a
year ago. He's doing the Alzheimer's Music Fest.
Yes,
and he's partnered with.
I'm sorry. Go ahead.
He's partnered with Dementia Spotlight Foundation and Common Sense Caregivers, Gary LeBlanc. These are all people I hope that you will interview too, because they have tremendous stories and they're making differences right here, right now in people's lives. Caregivers.
I'm going to be talking to him tomorrow.
Who are you talking to tomorrow?
Is his name? I never can pronounce his name. The one that has the music festival.
Vince Sangaro?
Yes.
Yeah, cool. That is excellent. And also check into Gary Joseph LeBlanc.
LeBlanc?
Mm-hmm.
Gary
They're both
Joseph?
on Facebook. Yep.
Okay.
Gary Joseph LeBlanc.
Yeah.
He's spearheaded. He trains people in hospitals and facilities. He's implementing a thing called the Purple Wristband Program, which is a medical band that indicates a person has dementia, and he's offering training to law enforcement and medical facilities about how to handle and deal with people who have dementia. And a purple wristband is a very easy way to identify it, and it goes around the loophole of HIPAA because it doesn't say exactly what your diagnosis is. It's only a color.
Yeah, that's all.
And it's starting to spread around the country, and I think will have a very good effect because let me tell you something. As a medical person myself, I'm telling you, medical people do not get it, and they think they know it all.
Oh, they do. Well, I shouldn't say they do. I mean, I'm only because I've been infected by it with my friends, the two, like I say, two females, and they've passed since then. But I think what it is when I was talking to Betsy was I know there's a lot of information out there. There's probably other radio stations maybe doing something, but apparently it's not enough. We need more voices out there.
We do.
And so there's where I came in, and I'm trying to put it out there for everyone,
Excellent. Well, I know I'm pretty hooked into a lot of different groups and a lot of different people, and I do stay in touch with a good solid core of them, which includes some of the people you've interviewed, Cassidy and Betsy, to name a couple of them.
Right.
And we're all working together to make a difference, to make things happen. I started a local support group here where I live in a little small county in Florida called Levy County, and I started a group called the Life Raft, and it's just trying to get help out locally, right here on the ground, right where people need it, right where I live. And this is the difference I see unfolding with all of these support groups now, is that we're connecting it more of a kind of, even though it's international and it's virtual, online, it's global, but it also has this grassroots component where we can connect with people who live right around us and say, oh, hey, can you go pick up my meds for me because I can't leave the house. I don't have anybody to watch my loved one. There was times I couldn't even go to the grocery store. Things like this.
Yeah,
I mean, you can't get that when you call alz.org, and they're great at what they do. We need funding for research. That's what they're good at. Let them do it. In the meantime, all of us out in the trenches, we need to form our little local communities, and we need to reach out to each other and say, hey, I'm available to help, even if it's just to listen to you because I live 5,000 miles away. I get it. I understand. And then with the people who live around us, that's where we need to keep telling our stories and put a spotlight on this so people recognize it. They will come out and they won't be so afraid. Especially where I live, there's still this big stigma. People don't want to talk about their crazy aunt or their loved one who has a disability. It's kind of hush-hush.
It's because it's the unknown. When people don't know things or don't understand something, it's like, it's unknown territory, and I don't want to know about it. But what I'm trying to do now is also, Marcy, is to, with all these different groups, I'd like to put something together where they would have all these different groups that people could reach. Does that make sense?
Yes, like a directory.
Like a connection. Yeah, like a directory.
Yeah, like a hub.
I was going to do something on YouTube.
Excellent.
I was going to call it a resource center or something. I don't know what, but it came to me when I was talking to someone. I said, there are so many different people. There's pockets of people doing little things, and if you could get those pockets to connect with each other, do you realize what an unbelievable?
Yeah, you could start a YouTube channel, and for caregivers and their loved ones, and all of these people I know. Like, I make videos. I'm a photographer. I'm an X-ray tech. I'm visual. It's what I do.
Yeah.
All these people who make videos and speak out. Even these radio programs, you can put those on YouTube as well. You could even set them up with and have them there accessible so people can go, and you could organize it as a library under kind of different topics, so it's easy to find stuff.
Yeah, they can find things. So
I think it's a great idea.
I just thought that would be something where when I'm talking to different individuals throughout the country, I'm going, wow, all these little places and all these places people are doing things, and one doesn't know what the other one is doing. Maybe one can help the other, et cetera, down the road.
Exactly.
And that's what it is. It's building I can't get the word of what I want to say.
It's a network.
Like a satellite or something.
Yes.
A huge network where people can go, because what I found is sometimes when I'm talking to different individuals, it's a deal where it's like, okay, they got the news, and now what I do now what do I do? Because the physician's not really helping to connect them to different places.
Right. We need a list of here's what's available in your area. And people can come on and share that too. I'm from so-and-so, and this is what I do. If you live around here, get a hold of me. Yeah. Things like that. Absolutely.
I just have to plan it out a little bit that would make sense. And, but I just know it'll be valuable to everyone. And obviously, there's you're not going to charge people to come in there. They're going through.
No, these are the caregivers who are like living on Social Security if they're lucky.
They're going through a trauma as it is, and then you're going to say no. What it is it's a spot where people can come and find stuff. And maybe if you'd like to be involved in it with me, I'd appreciate it. Any kind of input that.
Count me. I am a network builder. I'm a storyteller.
Oh, I love that. Yeah.
And this is what I've been trying to do myself here alone in Little Williston, but I can't do it alone. I want to put my energy in with like-minded people. That's why I'm a big support proponent for Vince Sangaro and for what Gary Joseph LeBlanc is doing. Another woman that you really need to talk to, her name is Karen Francis. Do you know her?
No, that name's not familiar. I don't recall that. No, that's not something that she's, that Betsy goes out there and says, please, if you tell your story, here's the information. Call her, contact her, and she will put you out, and she will let you tell your story,
Yeah, she's been trying hard, and, it's funny how many people, either like me, you get really busy, or you're just so caught up in caregiving you don't have the energy yet.
Yeah.
But the source to tap is all of the people who are now on the other side of caregiving that have lived the whole journey. And so many people on the other side are going, now what do I do? I lost myself in 20 years of caregiving. I don't even know who I am anymore or what I can do. And I hear these people every day of my life. They're struggling, and they want to help. And so it gives people like that an opportunity. Karen Francis is a very interesting story. She's a social worker, and she and Gary Joseph LeBlanc both, they were awarded the Presidential Award for their outstanding work and dedication in the field of dementia.
Good.
And Karen Francis has a very interesting story. She has set up and run different memory care places and facilities. She's a big proponent. And she had, it's just tragic, but this guy she knew almost beat her to death. And she survived, and she now has a traumatic brain injury, and she gets little seizures, and she can't drive. But she's still very much a proponent. But her life has come like to a crashing halt almost, and big change. And she flew down to Florida where I live, and she helped me launch the life raft. She helped me do them. Yes, and she knows so much, and she's someone else. All these people I'm mentioning to you, they're all on Facebook.
They're all on Facebook. Okay, so it's Karen Francis.
Yep. Gary Joseph LeBlanc.
And who's the other one?
Vince.
Oh, yeah, I have him. I'm talking to him tomorrow.
Right. And you know who else you want to talk to? A woman named VJ Jackson. She's a lovely woman. She makes these little things. Her mom died of Alzheimer's. And these people I know, they're all in this little small group of caregivers that I met up with quite by accident. I found myself thrown in this group of like the rejects that were kicked out of the big group because of judgmental stuff. And we've hung together for over 3 years. This is how I know Betsy. And really, Betsy read my story, and I shared a lot of videos and things of Gay Donna. And it really changed. It got her spark going, really. You know, she's all about it. She's like, you know what, you really got me going about that place and telling the story. I'm so happy to see these ripples unfolding. This is what I've been trying to do.
It's just like for me to see her that one night. Why? I have no idea. Why was I on? I don't even know. But obviously there was a reason.
Oh, yeah.
And there she was, and I went, wow.
Yeah, I've learned you follow the breadcrumbs in life. You follow them.
Oh, I did. I followed it.
Yeah.
When I feel this deep urge, then something I need to do, I really will plow through and get to whatever I need to find out, really. But it's just a wealth of information out there. It's just that too bad that, if I can figure out this, YouTube thing, I'm not sure. It's not hard. It's just trying to set it up and have places where people could go to find, like a center to find things out.
Yes, absolutely. And I use YouTube all the time. I've made, about 65 different videos. Over 30 of them, I think, are about dementia caregiving. And I have a public channel on YouTube. What I do is I take songs and I put caregivers let me use photographs of their loved ones and of them and of things that they value in life, their happy place things.
Yeah. And
I tell stories to songs. And, between the words of the music and the images, it's a very powerful medium. And caregivers share these with me so that I'm able to make these videos. And on YouTube, it's called Marcia's Dementiaville Highway. There's a bunch of videos.
Because I can put it on for people to look at. Marcia, Marcia. Dementia.
Yeah, Marcia's Dementiaville Highway. Or they could just even search my name on YouTube, which is most of our.
Because that information is important. Any little bit is important to me to put out there.
Yeah, and I think like a good idea that might help towards what we're both talking about, like this hub of information that will help people sort through it more quickly and efficiently, is we find people in different geographical areas and ask them, or if they want to help, you say, here's something really big you could do to help. Can you provide me with a list of resources in your area with phone numbers and addresses? Like, who's the ombudsman in your county? So many people don't know who to call when something goes wrong in a nursing home. You call your ombudsman. And people don't know these things. So there's people everywhere that have more time on their hands now because they're on the other side of caregiving.
Well, they'd be the ones that could help out. Because, see, I used to be I don't know how they call it in the rest of the country, but here they call it shine counseling. And I used to work for a HESCO, an umbrella, an organization where you could go there and there's a wealth of information in there for you, helping you to pay your bills, or if you needed help with, caregiving, because I used to work in that facility. And so I know about the ombudsman. I know all about that stuff. And you need to know who the ombudsman, but you have to find out the facility in your state, that's handling it, And I can take care of my state for a couple of places. They're just phenomenal, really are.
And I've done that already in my local area because I started a local support group. And here's the thing. What I found in my county, we're this little, we're a podunk county. There's 3 traffic lights in the whole city I live in, town. You blink and you miss it if you're driving, that kind of thing. It's really small. There's less than 3,000 people live where I live in city limits. They're all out in the woods in the county, and we're poor. And so what we face in Levy County is that if we want resources, we have to drive like 30 minutes away to Ocala, which is Marion County, or to Gainesville, Florida, which is a huge medical hub in Alachua County, for any resources. And they'll help us, but there's nothing right here. And for the caregiver who's stuck home alone caregiving and can't even go to the grocery store, it might as well be 3 light years away. And that's been what I've been trying to focus on and figure out a system, to help these little poor counties that, have to go to outreach to other places to get help. And that's where so many caregivers are really in a bind.
Yeah. I'm not sure, I don't know if this could help, but I have a friend that had cancer, and she was when she first was diagnosed, and we started up a thing called the meal train, but perhaps you can do it other ways where people could volunteer their time to go to someone's house and help out. I mean, it's like offering respite. Yeah.
Even if it's only 4 hours so you can go do shopping.
I'll send you the site for you to look at and see how you can intertwine it. I mean, this was unbelievable because once we set it up for my friend for a couple of weeks, we set it up where every day around 5 o'clock there would be a meal coming, and they would tell you what the meal would be, and they would deliver it
and because I know Meals on Wheels has taken a big hit as far as any kind of support.
Yeah, but this here is
really been up to the communities themselves to
so
do
if you
things.
could do something like this, instead of doing meals, volunteering, or even meals coming in, people helping out. Be surprised what people will offer to do. I mean, the whole calendar was booked up for us solid, so now we can't use it anymore because she is on this very special diet, so it wouldn't work, But certainly we could maybe use that in place of a meal and do something else with it.
Or like even going, picking up prescriptions for caregivers who can leave.
You could set up.
Because around here, places don't deliver. I know in other bigger cities that you can get your prescriptions delivered or, mailed, but, there's a nightmare with mailing meds when you need it today and you're out.
Yeah, but I have Script. I don't have Script, but I know that if you order on Script instead of going to the pharmacy, and if you order it in time, that medication will be mailed to your house.
Yeah, if you get it done in time. But I know that some caregivers they just lose track. They're so overwhelmed.
Yeah, they struggle with it. Yeah.
Or something happens where the caregiver pours it out and all the pills get wet, or things like this happen every day in Dementiaville.
Oh yeah.
Why? Yeah. So there's so many different things people in local areas could get together to do, but what I've found is that I'm on the search for those in areas that can kind of help lead and keep things going and providing some enthusiasm and keeping it going, the energy going, and it takes local people to do that. I kind of had an idea when Gay Donna was still alive. We talked about it, and it's sort of about taking grassroots ideas on the road. And it's turned into the most cumbersome, hard thing logistically to figure out. Because it's possible, it's doable, but it's quite expensive, and I would need to find a bunch of good sponsors.
Yeah,
it would basically entail a crew that would go to these little areas and find out what resources are available, get all those people's names and contacts, and then set up a space where caregivers can come and phone numbers to call, and spend a period of time in that area with these people I am calling like the local leaders to keep it going once the thing is going kind of in that area, then move on to another area. But you can see what I'm talking about. The logistics of figuring all that out is immense.
Yeah, it'd be a massive, but if you have a good group of people behind you helping you, it could be done.
And that's what I'm looking for. And so, like this conversation we're having today, who knows where it's going to take both of us. We're going to end up meeting other people, other like-minded people, and that's what's happening. People are connecting with people, and they're saying, forget all of this bureaucracy and all of this Medicaid and all of this and that. Right. We're just going to do it. And people are doing this all over. Yeah. It's starting to happen, and I'm really, really happy to see that.
Well, I'm excited about it, but I know we're coming to the end here. But I wanted to know, first of all, how are you doing?
I'm doing really well. The first 2 years after was, which it's not even been 3 years since Gay Donna died. She died 2 days before our birthday. We had the same birthday. She died April 16th, 2016. And I had been having chest pain for a month, the last month of caregiving. And being a medical person and being a widow who survived a widowmaker heart attack, I had every reason to be quite concerned about that. And I went right from Gay Donna's hospice care bed where she died peacefully to the hospital. And I spent our birthday in the hospital. Mm-hmm. And it turns out that my heart is okay. What had actually happened is I tore muscles in my chest, caregiving, lifting, right? Sure. And what are the odds that I would tear the muscles right where my stent is in my chest? What are the odds?
The odds are
well, I know what it was. It was Gay Donna telling me, you better get your ass to the hospital and take care of yourself. It's time for you to be the care receiver now. So after Gay Donna died, I spent a good over a year learning the lessons of a care receiver and trying to take care of myself. I lost a lot of peace in this journey. I had to go get dentistry work done, and I'm still taking care of that. And I regained my health. I'm healthy again.
Good.
But it's been slow going, and I'm just now, as I look back, realizing what a fog I was in for so long after she died. I was just still like on Energizer Bunny zombie land mode. Yeah. You know, you just keep going and going. And I think part of that is a defense mechanism that we numb ourselves on purpose just so we can bear it daily.
Just so you can get up and put your feet on the floor.
Right. Yeah.
Really?
And it does, you know what? That doesn't go away. If you spend 7, 10, 17, 20 years caregiving like that, you don't just pop out of it the next day and go, okay, I'm going to go back to my life now. It takes time. And it takes patience. And it takes some
time and process and taking care and feeling and making
it does.
The feeling.
And just like dementia patients, people with dementia, every person's different in how they deal with their grief also.
Yes, there's true.
And there's a lot of judgment around that too. People are like, all right, it's been a year, get off your butt and go do something now. And people, it's like, hey, you can't tell people that. No, you can only do you.
Everyone takes it differently, and that's the way it is. We all process differently,
Right, and the best.
Yeah, but before the best
thing. Well, let me just throw out there real quick. The best way to learn how to do some of this stuff is to connect in these groups, these caregiving groups, and get ideas from people who have been through it. It might work for you, it might not, but you never know unless you try. And if you never ask, the answer is always no.
Yeah. Because I've always said to these, some of the caregivers, you just never know when you're listening to one of the other stories that are out there that there's that one word, one thing that person says, and you've connected, and it helps you. But you know,
exactly.
You just don't know. But you have to be, partake in it and listen.
That's right. That's right.
You have to be, in it, not only listening, but you have to be in the process of it.
Yeah.
It's not an easy situation, but with help from all the other caregivers, you can help work it out in some way or fashion to make life a little easier, and not so
lot
hard.
Easier because we all carry the weight instead of one person alone carrying the entire burden.
That's right. So before we end, yes, definitely. So before we end, is there any kind of words of wisdom you'd like to say to our listening audience?
Yeah. Follow the breadcrumbs in life. Look for the good things that happen every day. Even if you're having the most horrid of days, take 5 minutes for yourself, go sit down, breathe, and think on something that puts a smile on your face, because that's the energy that's going to carry you through this journey, and that's what I call the happy place.
Definitely a happy place. Well, thank you, Marcia. You're giving so much information and so much, hope to a lot of these individuals, and hopefully you and I can connect again, and perhaps if you have something you want to talk about again, you can come on, and be on the show, or maybe we can work together on a channel for the caregivers.
I would love that. I really would. And thank you, Betsy Workle, for reaching out to me and connecting me with you, because it's really been things like this don't happen by accident, Jeanne. No. And I think that, we're going to continue this ripple. I, for one, will never shut up about dementia. Sorry, it's too late. My mouth is open, and I will always be an advocate.
Well, that's what you need. We need more caregivers to come and speak, and at least I think I feel good when I say to them, just tell your story about you and how you feel and how it happened. Whatever will make it easier for you. And by the end of the conversation, they would like to talk more and more.
Exactly, because stories open up people's hearts.
That's right.
Where advice, statistics, data like that doesn't open a heart. It's good to know, but if you want to unlock someone's heart, tell your story. People hear those.
Your story, People are going to need it. It doesn't matter how many times it's said. Everyone's story is different.
And as I'm sure after we hang up, more names of people are going to come to me, and I'll send you a message about that. But, by the way, this person too, and this one, and this one, and this one. Because I have a bunch of people already, names are ticking off in my head, but I'll send you a PM with those other names.
Okay, we'll do it. We will do it. And then maybe down the road, I have Betsy on and Cassidy on. We do a Zoom once in a while now and to cast out ideas and stuff. Maybe you'd like to be involved in it if you're available. All right.
I would love to. And, especially the Zoom thing, Cassidy often does little hangouts.
Yes, she does.
And I've been on some of those. I'm the moderator. I'm one of the moderators in the Caregivers Hub, the group that she started on Facebook.
Yeah,
so I stay connected with a lot of this, and I am all about getting the word out there and making good ripples happen.
We will. We just certainly will, Marcia. Thank you. Thank you again. I appreciate it. I know you've been busy, so I'm glad we caught up today, and I'm sure the universe was playing a part in that role.
It.
Yes. Well, I want to thank everyone for listening to my show today, Jeanne White from Social Connection on Passionate World Radio. And I want everyone to have a good day. And thank you again for listening. Bye now.